for being here. So what I'd like to talk about is the vaccine. I think we all would to a certain extent. But when any new vaccine becomes available for the first time, there's always a lot of speculation surrounding it. Speculation about how safe it is, speculation about possibly how well it works, how effective it's going to be. And that's especially true with the COVID-19 pandemic, because we've been waiting for this vaccine or these vaccines for so long. So there is a lot of information out there about these vaccines, and sometimes it can be hard to tell fact from fiction, to know just what a rumor is or what's rumor and what's actually true. So today I want to share some facts about the COVID-19 vaccines being used in Pennsylvania, and you're going to be hearing more from Dr. Chuang in just a minute. But I want to share the facts to help more Pennsylvanians feel comfortable about getting vaccinated, because the COVID-19 vaccines are really an important tool in the fight, in our fight against COVID-19. But they're only going to be effective if Pennsylvanians actually get vaccinated. And we should get vaccinated because these vaccines are both safe and they're highly effective. It's what's going to take us through this. I've said before that I will not jump personally. I'm not going to jump in line to be vaccinated. I'm going to get the vaccine, and I can't wait. But there are people at high risk of contracting COVID-19 who should be in line before me, and they should get vaccinated before me. But when it's my turn, I'm going to get vaccinated, and I look forward to that day. I'm going to encourage my family members, and I'm going to encourage everybody in Pennsylvania to do the same thing. By the way, you don't have to worry about the cost. COVID-19 vaccines are being made available to all of us for free of charge in the United States, including through the many state-based exchange programs available through Penn here in Pennsylvania. And you don't have to worry about cost. And you also don't have to worry about safety. These vaccines are safe. They've been thoroughly researched. COVID-19 is an unprecedented global pandemic, and it elicited an unprecedented global response. When COVID-19 began to spread throughout the world, medical researchers and scientists, actually again all over the world, pushed other projects off their plates and committed themselves to the creation of a vaccine. One of the things that has historically slowed down the development of vaccines is the lack of resources, the lack of money. But this past year, researchers developing a COVID-19 vaccine were supported by immense investments of resources and money from governments and from nonprofits, with the goal of giving them all the tools they needed to work quickly and work effectively. We live in a time of groundbreaking research and scientific discovery, and when paired with the unlimited resources that allowed vaccine producers to develop safe and effective vaccines quickly, that was a great combination. Researchers and vaccine developers were able to use advances in vaccine technology developed over the last several years to swiftly develop vaccines now in use to combat COVID-19. And their success is a testament to the importance of the public investment in scientific discovery. It is impossible to get COVID-19 from the vaccine. And while some people might have minor side effects after receiving the vaccine that can last maybe a day or two, like aches, chills, low fever, or tiredness, like you sometimes get with a flu shot, that's actually a good sign. It means that the vaccine is doing its job and teaching your body how to fight COVID-19. By the way, it's the same thing that happens when you work out. Sometimes your body needs to recover from training when you build new muscle too. The vaccine is like a physical trainer for your immune system. It's the same principle. And sometimes your body needs a little more time to recover from training and build new defenses against the virus. I know that this year has been a hard one for all of us. Many of us are more tired, scared, stressed, anxious, just plain fatigued as we go about our daily lives than we ever used to be. And that's completely understandable. And it can make us maybe a little more wary of good news. But I'm here to tell you that the COVID-19 vaccine is safe to use and very good at protecting people who are vaccinated. So if you hear a rumor about COVID-19 from a friend or see something online that concerns you, take a few minutes to verify the information before you get too worried about it. You can always find accurate, up-to-date information about vaccine safety and distribution on our website here, the Pennsylvania Department of Health, or you can go straight to the Centers for Disease Control and Prevention and find out from them. Either way, this is a great thing for Pennsylvania. This is the light at the end of the tunnel. let's go out and get our vaccines. And now, for a doctor's perspective, a real doctor, I'm a PhD, but as my mother always reminded me, I'm not a real doctor. Vaccine safety, I'm going to turn things over to Dr. Cynthia Chuang, Chief of the Division of General Internal Medicine at the Milton Hershey Medical Center. Dr. Chuang.
Thank you, Governor Wolf. Dr. Wolf, thank you very much. Very excited to be here to share a few words about what we know about the COVID-19 vaccine in terms of safety and efficacy. We know that there's 2 vaccines currently that have been approved by the FDA under an emergency use authorization. And what we know about these vaccines is derived from really rigorously performed clinical trials. And these clinical trials included participants of all ages, racial and ethnic backgrounds, and different health conditions. So these trials really did a great job of representing our population. So these trials demonstrated that the vaccines are highly effective, like Governor Wolf said. The vaccines are the Pfizer-BioNTech vaccine and the Moderna vaccine, which were shown in those trials to be 95% and 94% effective at reducing the risk of symptomatic COVID infection. 95% and 94%, that's really remarkable. So just to give a comparison, our seasonal flu vaccine, which we rely on very much, usually ranges between a 40 to 60% efficacy. So the efficacy of the COVID vaccines is really remarkable. So how about safety? Like Governor Wolf said, you know, there are some common expected symptoms that we should all be prepared for. Like all vaccines, you may get some injection site symptoms. There might be a little soreness, there might be some swelling, there might be some redness. Expect that. 80% or more of people are going to get those types of mild symptoms. Similarly, you may get symptoms like a low-grade fever. You may feel very tired. You might get a headache. You might get some muscle aches. Probably 50% or more of people are going to get those symptoms, but they're mild. They will be resolved within 1 or 2 days after getting the vaccine. They should be expected, and they're mild. And like all vaccines and all medications, you know, some people will have an allergic reaction to the vaccine, but I want to assure you that those have found to be very rare, luckily, so far. So we know that as of December 23rd, there were nearly 2 million doses of the vaccines administered, and there were only 21 cases of severe allergic reactions reported at that time. So that is 11.1 cases of severe allergic reaction per million doses administered. So those are rare events, and I think that's remarkable. I'll just conclude by saying that as a healthcare provider, I was very lucky and happy to be one of the first people who received the vaccine. I got my vaccine right before the Christmas holiday. I can't wait. I am so excited. I cannot wait to see my patients. I'm a primary care physician. I can't wait to see them be offered the vaccine. I have conversations with my patients on a daily basis. They can't wait. They are anxious. They are asking me very good questions about the vaccine, and they are looking forward to getting it, and I'm looking forward to them receiving it. So thank you for that. I'm excited to, lucky to pass the microphone on to our Pennsylvania Secretary of Health, Dr. Rachel Levine.
Well, good afternoon, and thank you, Dr. Chuang, and thank you, Governor. Our mission to immunize any Pennsylvanian who wants a COVID-19 vaccine continues. The Federal Pharmacy Partnership has set up vaccination clinics at 159 skilled nursing facilities or nursing homes this week. Vaccine providers have administered 16,925 COVID-19 vaccines since yesterday's report, and that brings the statewide total of vaccines administered to 311,477. This includes 251,133 individuals who have received their first dose of the vaccine and 30,172 people who have received actually 2 doses of the vaccine, and they are fully vaccinated. In addition, more than 52,000 residents and staff of skilled nursing facilities have now been vaccinated, and this is through the Federal Pharmacy Partnership with CVS and Walgreens. Now, we know that an additional nearly 138,000 doses have been allocated for the state this week, and so far, 107,600 of those doses have been received, with more doses coming Wednesday, Thursday, and Friday. I strongly encourage healthcare workers who are in Phase 1A, who are not affiliated with a hospital, to now go to the map on the vaccine page of our website to see where they can go to be vaccinated. Each vaccine provider in Pennsylvania is listed now, and we have indicated whether or not they currently have vaccine, and of course the contact information for you to register to get vaccinated. We sincerely want you to get vaccinated as soon as possible. Pennsylvanians are ready for the vaccines. Now here's what you can do to get yourself ready. Please talk with your healthcare provider, as Dr. Chuang was talking about, to confirm that you are a candidate for to the vaccine and to answer any of your questions about it. Visit our website at health.pa.gov for the latest information. And please, everyone needs to keep up the great effort to stop the spread, to mitigate the spread of this virus. Please wear a mask, wash your hands, social distance, avoid large and small gatherings. We must have patience, as the amount of vaccine available to Pennsylvanians is still limited, and it will take time before there's enough vaccine available for everyone. So we must demonstrate our personal and collective responsibility to each other by following the basic mitigation message that we've been discussing.